improve overall workflow and efficiency in our clinic because we have a captive audience every day, twice a day, where we can relay information, important updates, we can teach, we can remind them to do things for us. Every day, twice a day, we have all of them together, all the residents, the faculty, the staff. It's a great time to talk about things that matter to the clinic, talk about our philosophies. It's just a good time to get to know each other, do funny things on Friday, just to lighten the mood and to break down the barriers between staff and providers. So it's a good thing.
Good morning, welcome to Wednesday's Huddle. I know there's been a few people who've been here earlier this week and had a look at the bulletin, but there's a number of us who haven't. Anybody have any ideas about the things you might want to talk about that we have on here today?
Team huddles have definitely improved my workflow because when I'm working with a provider, at the beginning of the morning or beginning of the afternoon when clinic is about to start, I can talk to the doctor that I'm going to be working with, what their schedule is going to be like, what kind of patients are on their schedules, what they're coming in for, and what kind of stuff that they're going to need from me as a medical assistant.
I think maybe the article on the back that talks about men avoiding medical care is pretty interesting. I think as a resident provider, Huddle has really helped me to organize my day, number one. I think it's a good way for me to get started every day in clinic. Because we are rotating on so many different services, it's really nice to know that when we're here in clinic, we have an opportunity to get our feet on the ground, get organized, talk with our staff, and kind of recenter ourselves and get ready for that half day or that full day of clinic. And I think that's something that I'm probably going to take with me to my next location, my next clinic, or whatever I choose to do after residency, because I feel like it's a really good organizational tool.
When we do the huddles, all the providers and the faculty, they're all on the same team because we have the billers over here, we have the referral people here at the phone room, somebody's there. So that way, if there's any billing questions, they can answer those, any referrals, questions the referral people answer, anything that relates to the MAs, medical assistants, we can answer those. And there's a lot of teaching done in the huddle too with the residents because it's a teaching hospital.
Another thing, just to update folks, is the phone call speed to answer. We've made some progress.
Definitely.
Any suggestions for us?
Just primarily just checking your in-basket at least once a day. I sound like a broken record, but because the faster that you get back those messages, the less likely that patient's going to have to call in again and say, hey, I never heard. And the more that we can get our patients signed up on MyChart. The huddles are daily in the morning at 8 o'clock and also again at 1 o'clock in the afternoon. So about 15 minutes before the first patient arrives, all the staff are there. It helps get all the staff to one spot on time, which is, also improved efficiency. Providers aren't late for the huddle, they're not late for their first patient, so that's always good. And so we have those huddles, they take, about 5-7 minutes, and then the remainder of that is one-on-one with the medical assistant. I think faculty participation is key. It's nice to assign a resident as a team captain, but without having the faculty there to kind of back the whole process, I don't think it would have gone as far as it has. And the fact that a lot of our faculty, work closely on the huddle weekly or every other weekly with their meetings for the HRSA grant, they are showing that it's important and that it matters. And I think the residents pick up on that when they participate in the huddle and have topics that they submit or just help facilitate a conversation. They're wonderful at that. I think the huddle increases everybody's satisfaction because, when you put energy on something, it matters, and our patients matter, and we want to be the best that we can be for them, and we want our staff to have good satisfaction too because they're here more time than they are at home, and so we want their time here to be good and productive. And if our providers are efficient, then our patients are happy, the staff are happy. It's a win-win for everybody. So
this is the interns orientation week. Today they have their hospital orientation. Tomorrow they'll have a little bit more orientation for the office, and then Friday's their first day. So batten down the hatches.
The huddle is a really good tool to introduce new topics, especially topics that residents might not be familiar with, things like the medical home, especially because in a learning environment, there are new things always to discuss. It's a good way to at least begin a discussion of new topics and to familiarize residents with elements of the medical home. What does it mean to discuss with staff what their perception of the medical home might be and how those perceptions might differ from being a resident physician to being an attending physician to being an MA. I think having faculty involved really does benefit the team process because it helps provide some additional leadership, helps to guide our discussions, especially when we're talking about cases and situations that as residents we might be less confident in dealing with. And it also allows the residents to take a little bit more of a leadership role and to see the modeling that the faculty do in terms of how that interaction with staff does go. Gives us a good example of how we can model our own behavior. I think Huddle really does help my workflow. I've learned a great deal about how to be more efficient, and as an intern I was really nervous that I would be able to stay on time, and it's something that I really struggled with. But over time, the Huddle has helped me to prepare ahead of time for patients that I know might be more challenging, to discuss with my medical assistant and perhaps give that person a heads up about something that I'd like done beforehand, or something that I'm going to need help with regards to that person's care for the day. So I definitely think it's helped me to be a better physician and has helped me to stay on task and be more efficient.
Anybody else have any other issues for the morning? Meet with your MAs.
Generally, our huddles are done once a day in the morning at 8:15, and it consists of all the staff that are present in clinic at that time. The benefits from the piloting of our morning huddle are better communication, better understanding with the staff, the physicians, better coverage of the clinic, so everybody knows who's doing what and who to go to that day for questions and concerns. We do have gastroenterology, hepatology, pulmonary, and rheumatology, so different aspects of the clinic, you're doing different things and you're working with different providers for that. And it gives us a chance with the staff to talk about things that we've tried that didn't work so well and things that we've tried that did work so well, and how we can move forward to make it easier for the staff and the physicians.
Well, to me, I believe that our morning huddles actually make us a better team, because we have that continuous communication between the managers and the staff and the nursing staff, and it makes us a whole, and it actually benefits our patients as well, because we're all on the same page.
Probably one of the greatest benefits of Huddle is the fact that it creates a culture of teamwork. And that's something that is pretty easy to say, but it's not very easy to do. And when you're talking about a clinic that has a high degree of turnover because of the nature of our residency program, I think having something that's part of a routine, that's expected, creates a culture that it reinforces teamwork between the staff, teamwork between the residents, and then teamwork between faculty, staff, and residents together. And once that becomes an expected part of a clinic, it becomes that much easier to introduce new topics, to deal with challenges that come up, and I think it's a really effective way to move a clinic forward. Huddle is a really interesting tool that I think has the great potential to improve clinical outcomes. My experience with it thus far has been a 2-year experience, so I found that it's helped me to be a little bit more efficient. It's helped me to really use some of the clinical guidelines a little bit more effectively in that patient encounter, and I think it'll be really interesting to track how our patients are doing over time and to see how that quality improvement process is really working.
To me personally, it makes our clinic one of the best because of our communication between the staff.